Hello and welcome to this episode of SelfKind with me, Erica Webb, and my beautiful friend, Rachel. I just gave a little bit of I'm going to tell a story when I do this intro, and Rachel doesn't know what it is going to be. But as a little way of introduction, I had the absolute delight and pleasure of meeting Rachel in person when I was over in LA last year. And I had a moment where I was standing between Rachel and Anna Hartman. And I felt like I was just like in a brain sandwich. Like I was like, these are two of the smartest people I know in the whole world. And I'm standing in between them. And it was just an absolute delight. And then I got picked up by a friend and client who just did a little name dropping. She said, I think I know that there's like a few people here. One of them's that cardio-pulm person. I can't think of her name. I'm like, you mean Rachel? I know her. I can go and get her and bring her to the car. So we are in the company of greatness is my point. So welcome, Rachel. How's that for an intro?
That was too big of an intro. I don't deserve all of that. But that was the first time anyone has ever recognized me. I was like, me? Are you sure?
I'm like, who else is cardio-pulm over here? Come on, find me another one. So, I mean, that's an introduction that gives no clues as to, who you are and what you do, other than that you might be a bit of a rock star. So, do you want to do your own intro and tell people actually what it is that you do and a little bit about who you are?
Sure. I think the more practice I get, maybe the better I will get at this.
Yes.
I'm a PT by trade. I've been a PT for 14 years.
I'm just going to jump in 1 second. For our Aussies, a PT is not a personal trainer in the US. She's a physiotherapist.
Yes,
or
I'm a
physical
physiotherapist.
therapist.
Physical therapist. Yeah, physical therapist.
Keep going.
Been that for 14 years. For the last 9, I've specialized in geriatrics and cardio-pulmonary. So that's my main focus. I've really dove in 100% into cardio-pulm over the last 9 years. But obviously there's a lot of overlap with geriatrics. And I'm primarily in the hospital setting, have been for most of my career, and just recently have transitioned to owning my own practice, which is a slow build, but here we are. And I educate and mentor other PTs, physical therapists, and physical therapy students. It's going to be a hard
you
switch there.
You can say it now. We've described what that is. So
we've established it.
We've put that out there. People know what it is now. It's a funny one though, because I remember the first time I kind of started to be in the world of American PTs. I was like, are these all like? I don't think they were talking about the same thing. So it is funny how those things are different. But you are the only cardiopulmonary physiotherapist I've ever encountered. Is it a rare specialty?
It is. Okay, so I've had this conversation recently. It's one of the oldest specialties in U.S. physical therapy. It was actually created in 1981, and it is still one of the smallest. So there's 459 of us as of this past month. I think in June we should get another cohort in, so hopefully we will maybe break 500 soon.
That's really small. So as a cardiopulmonary, that's really hard to say. It's such a big word.
Cut it.
Yeah,
cardiopulm.
What are you like? What is that? Tell me more about what that is. I mean, I have some idea, but give us a bit of a view of what is a cardiopulmonary physiotherapist actually doing?
Yeah. So it has a lot of range. I think the primary patient population I see is in the hospital. So anyone who comes into the hospital with cardiac dysfunction. So the person who needs an open heart bypass and they're post-surgery, I'm that person who's going to meet you on day after surgery and say, hey, we're going to get moving. We're going to get your cardiovascular system up and going. And everyone will say, wait, it's only day 1 after heart surgery. Heart failure is another big diagnosis. So years and years of heart conditions leads to failure. And these patients tend to be deconditioned, short of breath, that kind of thing. And just really teaching them strategies on how to cope and thrive in their current situation. And then the other side of the spectrum would be our lung patients. So COPD is probably the most common that you'll hear, chronic obstructive pulmonary disease. So smokers, anyone who has emphysema, that kind of thing. But the range is long. So if you think heart and lung disease, that's usually where someone like me would pop in. But we're kind of across the spectrum because we can see patients in the outpatient setting who is also post-surgery, but they're further out down the line. So I've done that
Mm.
in my career as well. So the range is really wide, so to speak. But basically heart and lung conditions. And now in this new generation of
Mm.
pandemic life, we can throw COVID and long COVID in that mix as well.
Yes, yes, and that was you. You were an absolute, um, you know, you helped me so much when I had COVID, and passed lots of information on to my husband when he had COVID, and it made such a big difference. And that was one of the things that sort of triggered me to be like, oh, we need to talk, because I know that the work that you do is with a very specific, whilst broad, very specific
Mhm.
clientele.
Yeah.
Um, but I'm also really mindful of the things that we, as perhaps people not fitting into that demographic, can learn from what you know about, the geriatric community and the community sort of dealing with these challenges. You've taught me a lot about, vagal techniques, lymphatic drainage, breathing. And so we have had this conversation, but, doing it for the
Yeah.
camera. Well, I thought that's where we could kind of focus today, is like, what can we? Because I'm sort of like putting myself in the seat of the listener and going, okay, well, I don't have a lung disease, I don't have a heart condition, but can we dive into talking a little bit about some of the things that we, as people without those things, can learn? I had a conversation, as a bit of a explanation, with my husband actually the other day, around how it's so interesting to me how little we know about
Mhm.
our bodies and how little we know
100%.
about the way that we function. I was talking about it specifically in terms of the nervous system and our thinking processes around how we interpret what we're feeling.
Mhm.
But I feel like it's so, like, our cardiovascular and our, sort of breathing and our heart and all of this, it's such a mystery to most of us because we can't see
Yeah.
it. We don't have direct access to, like, look at it or manipulate it or do any of those
Mhm.
things. And so I feel like, maybe we could go into some sort of like owner's manual stuff, learn a little bit about ourselves through talking to you. Does that sound okay?
That sounds great. I mean, I think this is the interesting part, and part of what I want to do in my current practice is to not wait until there's disease to make a
Yes.
change. I think just in general, we've always been reactive instead of proactive. And I think just teaching our kids, ourselves, our parents, the simple things, like keep it
Mm.
simple. And I think this is why you and I vibe a lot on this kind of matters, because it doesn't have to be the over the top exercise session, but maybe try to incorporate a 30-minute walk daily.
Mm.
For one thing, just walking in general has so much benefit. Obviously, the cardiovascular effects, but if you think about it, walking keeps you independent
Mm.
through your lifespan, right? So, like, if you can keep walking, you can keep moving, you can keep doing, you can stay independent. So, keep it simple. If you don't have the opportunity to run, you don't have a treadmill, you don't have access to a gym, walking.
Mm.
We can simply add it throughout our day. Adding 10-minute bouts is effective in accessing cardiovascular health. And that's without talking about target heart rate and
Mm.
percent intensity. Just walk
Can
at
you
a moderate pace if you can.
Yeah, okay, so it doesn't even have to be, like, super, super brisk, but just moving
Mm-mm.
around. Can you explain to me, and I realize that we're kind of going back to, like, high school biology potentially, but, like, why? Why do we have to get our heart rate up? Like, what's the physiology there that potentially can be problematic if we're not doing it, you know? In
So, okay,
simple,
let's see
please,
how
terms, in simple terms.
I'm gonna
Remember that I
I'm
am
gonna I'm gonna throw out a big word and then I'm just gonna like break it down.
Okay.
So it comes back to like our baroreceptor reflexes and our regulating systems. So what happens is, as a human species, we ingest food, drink, pollution, right? Like we're taking in a lot of things and our body has to process that. And so if you go from the food aspect of it, we ingest cholesterol and all sorts of stuff, right? And we're not mindful about a good balance. We can have increased cholesterol in our arteries, and that can lead to buildup. and the list goes on. But it takes years and years and years for that to occur. And you're not going to really notice anything until maybe you have chest pain one day, right? So now we're past the point of making an effect. But in the point of blood pressure and heart rate, essentially, if you don't get your heart rate up and have this variability, your heart starts to reset higher and higher and higher. So every day, every time we do something, we have this reflex in our body to adjust to the activity that we're doing. And if essentially it starts resetting higher and higher, you end up with high blood pressure. So exercise, eating healthy, doing all the things that we know we should do basically helps to maintain that lower blood pressure. And that includes stress, right? High stress, poor diet, lack of sleep. All of these things start to trigger our heart rate to just sit higher versus coming back down. And if it stays high, then it can't reset. And essentially, exercise is a stop-start. So we start and our heart rate goes up, but when we stop, it should come back down. When we're just stressed or, have big meals or high alcohol intake, like you just start staying elevated versus that up and down reflex.
Yeah, right.
I think that might be the easiest.
That is a brilliant explanation. I don't think I've ever really heard it described that way. And it's interesting. I started tracking my sleep. And when I was researching like what app to use and all of that sort of stuff, they were talking a lot around heart rate variability and how that is such a good measure of, I can't even remember what word to use there, but kind of like our readiness for stress and all of that sort of stuff, right? Like in terms of our recovery.
It's basically a measure of your autonomic nervous system, your ability to adapt and change.
So is this the same thing? This is what we're talking about?
Kind
or
of.
Similar?
It's kind of in the sense that when you train and you are able to train at a certain percent for a certain amount of time, that is essentially conditioning for your heart. And then it's equally important to allow that body to come back to rest. And you should be able to do that within 5 minutes time. So that adjustment of increasing and coming back down, I guess, is a good way to say that you will have improved heart rate variability, or at least people who exercise tend to have a better heart rate variability.
Okay. So there's that. And then there's what you were talking about, where if we're not experiencing the down regulation, then we are starting to reset it's kind of like tension, right? Like if we don't release that tension, our baseline becomes, I wear my shoulders as earrings. And then that's where we're stuck.
Exactly.
Okay. That's really interesting. And it's funny because again, like I like to ask the questions that maybe seem a little bit like simple, because we might have learned these things, but we forget. And then we're just like, well, I should walk because it makes me a good person, like I should do this because it's the right thing to do. And I just think that knowledge is so powerful to help us get out of just like that shamey sort of cycle, right? Like I just feel bad because I am not doing the things that I should be doing. And so understanding like what is it actually doing for us, I think is such a gift.
Absolutely. I think exercise is one of the most underrated. It basically is the magic pill.
We're all looking for one, so that's handy.
You're all looking for one, right? You're looking for the thing that can help lower blood sugar. You're looking for the thing that can help lower blood pressure. You're looking for the thing that can help lower stress, heart rate, improve sleep. Like all of the things can be improved with exercise. So I probably did an injustice with my explanation, but essentially it does all of these things in our body metabolically to improve our overall abilities. So doing something is definitely better than nothing, and talking yourself out of doing the 10 minutes versus the 30, 60, 90 becomes a spiral of less and less and less.
Yes. And do you see that in the geriatric populations that you work with? Yeah.
Absolutely. I think the thing that you start to see is, well, I get short of breath walking a block, so I walk a half a block. And then a half a block becomes across the house. And then it becomes from room to room. And then it's primarily sitting.
Is that a fear-driven cycle then? Like
can be.
Yeah.
It can be. Falls is a big one. As you get older, increased
Mm.
risk of falls can lead to fear of falling, and therefore you do less and less. And we know the saying, right? The less you do, the less you do.
Yes.
If you don't use it, you lose it. It's true. It's the simple
Mm.
things, I think.
Mm. So then, the cardio pulm goes together. How
Yeah.
is what we're doing then also impacting the function of our lungs? If we just take the
So
walking
yeah,
example to keep it simple.
it's a good question. Sometimes I'm like, oh, that's a really good question. Let me see if I can get there. So I like to say the heart and lungs are married.
Okay.
They work very much together. The lungs supply the oxygen gets pushed through the body by the heart.
Mhm.
So they have to work together. And if there is abnormal function happening in the heart, it puts pressure on the lungs. If there's abnormal disease in the lungs, it puts pressure on the heart. So they can negatively affect each other very easily.
Mm.
When we incorporate breathing into our exercise, typically we can do more for longer. So, learning how to control our breath, we can increase our aerobic capacity, our ability to improve our endurance, essentially.
Mhm.
Um, we are able to improve our oxygen exchange, which can be important, especially as we age, because that goes down as we age.
Huh.
Um, and then we have the nervous system piece, right? So, the one thing I guess as I get older, move through my career is the more niche down sometimes you get, the more you have to start expanding and not get so tunnel vision because the heart
Mm.
and lungs do not work independent of themselves. They work due to function of the brain.
Yeah.
And so the brain helps control heart and lungs. And so they're very closely attached with the nervous system.
Mm.
So if we can control our breathing, we can actually decrease our heart rate. We can tap into our parasympathetic system and calm down stress. It's all very intertwined so that when we start to isolate these systems, we can get lost because we start to ignore the
Mm.
connection.
I was just about to make that leap and say I feel like so much of what you work with must be the byproduct of, or at least very influenced by stress.
Yeah.
Mm.
Heart disease in general has a high, I don't know what the percent is, but stress is a risk factor for heart disease.
Mm.
So, long term, you have this chronic stress, it can induce coronary artery disease, plaque buildup in the arteries, just
And that's
from,
because the heart rate elevation is just continuing to happen. Is that part of the reason why?
yes, and more of the blood pressure, heart rate and blood
Okay.
pressure. So, basically, when you have high pressure in your system, think of your blood vessels like pipes.
Mhm.
Okay, but they're delicate pipes. And if you have a high velocity force going through those pipes, those vessels start to break down over time. And when they break down on the inside, they allow for plaque to attach. So one
Ah,
thing is like a precursor to the next. So high blood
right.
pressure leads to heart disease because it basically the pressure breaks down the vessels.
I don't think I ever knew that. I knew that obviously there was the plaque buildup, but I didn't realize that that was a result of a breakdown of the integrity of the
Yep.
system. That's
Once you
interesting.
have the integrity breakdown, then the plaque can stick. So
Right.
it needs the ability to stick to then make a problem.
Huh.
So high blood pressure is called the silent killer because you have no symptoms. People
Mhm.
might not know they have it unless they regularly check their blood pressure, go for a physical, have a
Yeah.
device in their house. But having those high pressures for long periods of time basically creates havoc on the system.
So then my brain, this is not really what I want to ask you, but I have to ask it because I'm now perplexed. When we have this situation where we've had high blood pressure and it's breaking down the integrity of these pipes, then if part of what is like good for us, and I'm going to put that in bunny ears because I'm aware of the fact that it induces feelings of like morality, but we so hypersensitive to that. But if what is good for us then is to exercise, are
Mhm.
we like I can understand the fear element in that because are we not increasing our blood pressure or our heart rate when we exercise?
You are, but again, when you're able to increase from rest, you're going to come down, and basically you're going to help reset some of that reflex.
Right.
And so exercise on its own can improve blood pressure by 10 to 20 millimeters of mercury. So like as you start increasing exercise, right? So like your blood pressure is 180 over something, it can decrease it to, let's say, 160 over something. I don't know if you have different
No, that's how we do it.
units.
That's how we do it. Yep.
Okay. We'll see. Look, I learned something new today. But that essentially I actually don't know a great way I'm going to have to like work on explaining this. Essentially, if you are able to increase it from where you're resting, then it's going to come back down. And you basically have the opportunity for hypotension after exercise, which essentially says that after I exercise, I increase, right? I increase during it, but on my rest, I'm going to drop lower.
Yeah, right.
And the benefit then is that when you have that barrel reflex reset itself, now hopefully it's going to start resetting itself lower and lower. And essentially you unravel the opposite effect.
Interesting. Do you know what? It's really similar, but obviously a different system, but similar to the theory behind somatics, which is that if you take a muscle deeper into tension and then you consciously release it, it has a chance to reset its kind of like resting length at a more normal, quote unquote normal spot rather than being deeply into tension. So it sounds like it's sort of the same idea.
That's a very
like reset
good
button
parallel.
Yeah.
It's a reset button.
If you're not sure, just turn it off and on again.
And then to go back to your original question, breathing can help pull both blood pressure and heart rate lower as well. So it's just another technique that can tap into a non-medication technique that can essentially do no harm. If you add breathing into your life, you're going to have benefit.
Yes. I remember the moment. I don't really remember the moment, but I remember the I don't remember where I was and I remember what was happening, but I do remember like reading or hearing the science behind why slowing our breathing down can slow our heart rate down. And this idea that, the lungs kind of change the space that the heart has to beat and all of that sort of stuff. I would like you to explain it because I know you're going to do a much better job of it than me. If you're up for it, you're going to be like, what did I say yes to this interview? This woman is asking me the worst questions.
I should have studied. I feel nervous. Okay,
because I think it's an important link though, right? Because I think sometimes we don't, like, we hear this all the time. We hear, use your breath to calm your system. And people are like, go away with that advice. I don't want to take my 5 breaths, right? So I want to hear this, I know the science, but I want to hear the science come out of your mouth because you are one of the smartest people I know. And because I think it is important for us to understand, again, from that user's manual perspective of like, we have got so many things at our fingertips that we can use to our advantage. But if we don't understand why would we, right? Like why would we? So yes, to you.
So the space thing, I actually don't know the answer to it.
Okay.
Why giving more space would, but from an anatomical perspective, I can go there. So the diaphragm and the heart have a connection. So every time we breathe, you essentially rotate the heart down into the left. So every time we breathe, you sort of move the heart and the heart moves with our breath. How that directly correlates to heart rate, I actually don't know that answer. I don't know that as a fact.
Yeah.
The part where breathing affects heart rate control all relates back to the nervous system. So we have sympathetic and parasympathetic response. And when we tap into our parasympathetic response, it decreases heart rate and decreases blood pressure to a point. Because our bodies has fail safes that we can never basically overdo parasympathetic input because your heart would stop.
Yes.
So essentially there is minimal parasympathetic input into the ventricles, which do the main job of squeeze for the heart. But it does hit the top of the heart, the atrium, which is where the heart rate pacemaker exists. So essentially, when we tap into breathing and we extend our exhale, we tap into parasympathetic, and that literally lowers your heart rate. It's a direct correlation.
Yeah.
So when you are stressed, what tends to happen is you hold your breath and you can sort of, like, someone tells you to breathe and you're like, oh, I don't actually know if I've done that in a while.
What's the impact of holding your breath then?
You ask very good questions.
I am like that annoying 3-year-old who's like, but why?
The sympathetic system just does this. And you only can hold your breath for so long, right? At
Well,
some point
that's right.
your brain is going to force you to breathe, but the point is when you start to breathe very shallow,
Mm.
um, sympathetic is going to increase, heart rate will increase, and tension sort of just escalates too, if
And then it
that's
feeds
kind of the route
itself,
we're
right?
going.
It kind of feeds itself
Totally.
because then you're like, "Oh, I don't feel good, like I'm,
No.
and then you start to worry more and then it's gonna keep going in that direction.
Right.
Thank you. I
I
just
don't know if I answered that.
you did. It's it's the fact, like, I just think it's such a fascinating,
Hmm.
simple. I mean, I know it's not simple, like, from the point of view of, like, literally
Yeah.
what's going on, but it's simple to use, right? Like, this idea
It
of
is simple to
lengthening your
use.
exhalation, it is so simple to execute. And yet, I do feel like we are very quick to dismiss the things that are simple because I don't know why we do that. I wish I understood that part of us.
Yeah.
We want to make things complicated.
Or maybe it's more of a conscious effort that the onus is on you, so you have to control it. So
Maybe.
I don't know.
Yeah, it's
But it's
interesting.
the same with exercise, right? Like we know it has benefit,
Mm,
so much so that it could take you off blood pressure medication, can take you off blood sugar, insulin type medication. Like it can literally decrease the amount of pharmaceuticals that we're taking
yeah.
astronomically. But it's always a thing, even myself included. So I'm not trying to like sit on a pedestal
Yeah, yeah.
or anything.
What, you
Trust
don't
me.
you aren't motivated all of the time? Sorry?
I try very hard to be to live my message, but
It's
to
hard.
be very honest, when you're living your life, it's the first thing to get cut on a time schedule,
Absolutely.
right?
Yeah.
But then it becomes this chronic thing, and we if we don't get back to it or make it part of your daily habit, then
And maybe
things start to
that's
creep up.
yeah, and I was gonna say maybe that's part of it because the big impacts, I mean, I think that there's mental health impacts that can be felt pretty
Oh
quickly,
yeah,
but if we're talking about the cardiovascular system, like you said, you don't know anything that's happened really until it's almost like this has been going on for such a long time. So perhaps it's that immediate win is absent for a lot of us unless we
yeah,
do get a lot of joy out of the movement itself, which is, you know, true for some, but not for everyone. So,
yeah.
yeah, it makes sense. So, one of the things that you've taught me and that I
Hmm.
do um, very regularly is a lymph drainage massage. And you taught me
Yeah.
this. I mean, you didn't specifically teach this to me. You didn't hold me by the hand and be like, Eric, I'm going to show you this thing, but I learned it from you. And
Yes.
I started doing this lymph drainage massage when I
Hmm.
had COVID, and I have never
Yep.
stopped. I mean, I stop every
Yep.
now and then, I forget and whatever, but I feel
Yeah.
so much better when I do it, but I cannot put my finger on what I feel. I cannot actually articulate what it does, but I notice if I haven't
Yeah.
done it, but I don't know what I'm noticing. So that's wild to me. And I
Yeah.
would love you to sort of take, I know that this is all connected, but can you
Yeah.
take a little left turn and talk a little
Yeah.
bit about that? Because I know when I shared about my sort of daily
Yeah.
lymph drainage, people were like, "What is this?" And I need to know
Yeah.
more information. So, can you talk us through how that relates to what we're talking about here?
Sure. I actually started looking into lymph drainage and vagal techniques right around the time of COVID as I was diving into that literature. And basically, what I kept seeing was inflammation, 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 inflammation. And essentially, the inflammatory response that occurs during COVID and long COVID cause or as a part of the overwhelming symptoms that seem to linger.
Hmm.
And so I started to try to find different techniques that would help literally attack inflammation. So I've learned most of my lymph techniques from Perry Nicholson from at Stop Chasing Pain. So if
Yeah.
you want a very direct connection to lymph techniques, he's the main guy. I've learned most of my techniques from him. But essentially, the lymph system is a part of the cardiovascular system. And even though I'm a cardio-pulm specialist, I feel like the lymph system is sometimes the unspoken system of the cardiovascular system.
Hmm.
So you have arteries, veins, and lymph. And typically, same as what I told you earlier, is when you think of someone who's a lymphatic specialist, they're typically people who treat patients who have a failed lymph system, lymphedema. And they have very specific wrappings and massages that they do. But at that point, again, it's almost like it's a reactive intervention, right? And what I really love about lymph drainage and like all the things I've learned is really how I personally feel when I do both lymph and vagal. And essentially, the lymph system is the waste management system.
Mm-hmm.
So it helps clear cellular waste. And there are main areas in our body. We all know lymph nodes, right?
Mm-hmm.
In our neck, our armpits, and our groin. And they're in various places. We have a ton of lymph in our gut. And we have lymph in our brain that they've actually, I think it's one of the newest like anatomical systems that they've identified. It's called
Really?
lymphatics.
Mm.
The brain has its own lymph system.
Mm-hmm.
Anyway, if you don't have good clearance or you have backup, or let's bring it back to stress, right? When I'm stressed, my ears are also up at my shoulders up at my ears.
Yeah.
If you have tight traps, everything in this area is going to be tight. You have a ton of lymph area in your collarbone and right around your pecs. So if you're constantly in this forward flex position at the computer, if you're constantly stressed, it is very likely that you have stagnant lymph in this main area.
Mm-hmm.
And essentially, if you don't clear the lymph is going to stay stagnant. And essentially, stagnant anything in your body is never good. So think about lymph as being stagnant inflammation. And if you don't clear it, it just kind of lingers.
Mm-hmm.
So if you think about brain fog as being one of the main complaints with long COVID, and you have this inflammatory situation going on, if we're not clearing that lymph, it's just going to sit and linger and you're going to have these awful symptoms.
Yeah.
So lymph drainage is essentially massaging, tapping, vibration techniques around specific points in your body to help clear the system. And essentially you're clearing waste. So then you tend to feel more energetic. I feel very clear. Like I feel like I can focus better. I feel like I can streamline better. My joint pain is significantly improved when I daily limp. I've actually fallen off a little bit, and I've actually been like, oh, my back is a little bit more noticeable than it normally is.
Yeah.
So just creating it as part of your day can actually have a ton of benefit on so many things. Again, it's just essentially it's like brushing your teeth is how it's described, right? You brush your teeth daily, so you do your lymph hygiene daily.
Is there a way that our body is obviously doing something with that lymph. Am I right in thinking that it's assisted by movement? The pump of the lymph flow is kind of assisted by movement. So
100%.
If we're also stagnant, then we've got that as another.
Yes.
Yeah.
Correct.
Okay.
So think about like if you sit at a desk all day.
Yep.
You're flexed at the hips. You got a ton of lymph in your groin area. You're probably hunched forward. You're
right now.
Tight here. Stretch it out. And do you know what one of the biggest pumps of the body for lymph movement is? Breathing. The diaphragm. So the diaphragm is like this wonderful parachute that sits in your rib cage. And when it moves, when it drops, when you inhale, diaphragm drops and essentially pushes down on your abdominal contents and changes the pressure within your lungs and your stomach. So when it pushes down, increases pressure in the belly, decreases pressure in your lungs. So it creates a gradient. And the whole body runs on gradient. So when you exhale, essentially you've now created a pump, a vacuum effect to move blood up to your heart.
Which is also going to help clear the lymph. Yeah.
You got it.
Okay. And then...
So breathing helps with lymph. And so does exercise. And so does things like bouncing, just moving, vibration. So again, it doesn't have to be this whole routine. Yeah. Just movement will help lymph.
And then that takes us beautifully straight to the vagus, doesn't it? Because when we breathe, we're impacting the vagus. When we so what do you want to say about that? It's a very specific question. Vegas, go.
Vegas. So again, Vegas is something I did not tap into until COVID. And same thing. The vagus nerve is known as the vagabond because it's the wanderer. So the vagus nerve goes from the brain to the pelvic floor. It's probably one of the longest nerves in the body, and it has great effect from your brain to your pelvic floor. Big connection in the brain, big connection in the gut, and big connection in the cardiovascular system. So vagus nerve also helps with inflammation. So if you tap into vagus, it actually can help improve inflammation. So vagus and lymph techniques can very much overlap due to the areas that exist of overlap, but they also do a similar function. And essentially, the vagus nerve helps, again, tap into your nervous system, specifically the parasympathetic side, the rest side, and can just help regulate a ton of different things. Helps improve digestion, acid production in your stomach, heart rate control. I mean, it just continues.
It's such a fascinating.
This list is so long. It's wild.
It is wild, isn't it? And I often think about the vagus nerve. It takes a large part of my conscious mind because it also is so related to the way that we relate to other people and connection and feeling connected and feeling warm towards the world, which, I mean, sometimes can feel hard, right? And so I find it such a fascinating place to go. But I think it's another one of those places where, even from a professional point of view, those people who work with it, it's still fairly new in our kind of common conversation, I suppose. But people are like, I've heard of this, but I don't really know what I'm doing with it. One of the things, so I'm going to back up a second. One of the things that I think is really interesting about owning a human body is that we kind of just assume it's going to take care of itself. And I think that's a reasonable assumption in some ways, right? In some ways,
and for the most part, it does.
Right. Yeah. And we know that it's very clever and it does lots of really amazing things. And, like even from the way that it organizes movement when we're learning something new, like it figures it out. We don't always have to give it like step-by-step instructions. And yet, at the same time, if we're being a responsible body owner, there are things that we can do that also make a difference. So yes, your vagus nerve is just doing its thing all the time. Like, it's not like any of these things are shut off. It's not like anything's not working. But how and why would we want to, what's the right word? Why would we want to sort of like step in and assist that process, I guess? And how do we do that?
I think the world that we live in is very stressful, and we're constantly put in different environments where we have to adapt. And if we're not taking care of our body, then our body starts to fight or flight or fawn. And if you're constantly in that fight, flight, or fawn, that's very hard to say multiple times in a row. It's almost like a shutdown point. So your body's going to play defense at all times. And whenever you're playing defense, you're not really thriving. So it seems like you don't take note of it until you're at the stage where you start to become symptomatic. And this is actually a great conversation for JPB, who probably could go into the nervous system way more effectively than myself. But it also affects your adrenal glands and your cardiovascular system. And if you're in a constant state of stress, you may have heard of like adrenal fatigue. That is very commonly related to poor vagal tone. And so essentially, you need to tap into it to keep the system regulated.
Yeah.
And so I think if we can give our body fuel, just like you would a car, then it's going to run for much longer than trying to literally drive it to empty each and every time, which is going to put strain on the whole system.
Yes.
And I think that's that's the analogy, right? Like, if you can feed your body, if if you can set your body up for success, create a good environment, just like we were talking about plants earlier, right?
Mm.
If you set that environment up, that plant is going to thrive. If you don't give it the things it needs, it might still live.
This guy behind me is thriving.
That guy behind you is thriving. He's thriving. I
Despite
won't
my
show you
lack
my
of care. Yeah.
But the point is if you can learn these techniques, you can do yourself justice and
Yeah.
thrive for longer and maybe be more resilient in the things that are happening around you. Not to say that you have to like always be on, but to say that you are taking care of your body so that it can be in the moment when you need it,
Yes.
whatever that might be.
Yeah. One thing that's coming to mind as you're saying that is we're very quick to, I don't know what the right word is. We're very quick to kind of like get frustrated by our body's kind of like things that it does that are less
Yep.
than ideal. You know, we kind of feel like sometimes like my body's just breaking down. I'm just getting old. It's just blah, 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 blah. Like we get into these serious kind of frustrations with our body.
Mm-hmm.
And as I listen to you talk, I'm also like, but the system's kind of doing what it thinks it needs to do to survive in the climate that it's in. And so a lot of what I'm sort of taking from what you're saying is that it's not that we're trying to assist the body to do its job better. We're trying to change the kind of, like you said, like change the environment so that it can do all of its job, not just the survival part, you know, like not just the bit where like, yeah, we've been living with stress for 40 years and like, this is all I got left, you know. It's kind of more, how do we get it's back to that variability, isn't it? It's like we want a system that can do all of the things. Yes, we need it to keep us, you know, surviving. That's the whole point. But we want to feel those kinds of ebbs and flows from kind of thriving to surviving and back again. Is that an accurate kind of interpretation of what you're
I
saying?
think so. I
Yeah.
100% think so. I think the body is the most amazing thing that we have not fully uncovered, untapped. We don't even know the half of its abilities. The
Yes.
fact that it is able to do all these things simultaneously without conscious effort, thank goodness for that, because we would not run efficiently, right?
We'd be
I
so
mean,
tired.
I'm so tired. But the fact that we cannot replace things, I mean, going back to like the cardiovascular and pulmonary world, heart and lung transplants is part of what I see, right? But you cannot replace the heart or lungs. They just don't function as well as the original. We cannot make a man-made product that works as efficiently as our own organs. Any sort of replacement never functions to the capacity that our body does. And we have so many abilities to adapt, and there's so many backup systems in our body to keep us thriving. But we also have to like water the plant and give it sun and do the things that we can to like not just keep it going, but make it work healthy for a long period of time versus living in disease. I think that's the easiest way to kind of put that, because it's much harder to live in disease than to live in health.
Yeah. Yeah. And you know, my thing always comes back to kindness and kind of like that desire to be in relationship with ourselves in a way that is underpinned by self-love, self-kindness, self-care. And that's what I hear when you say that, is it's like,
Absolutely.
you know, rather than being at odds with this body that we live in, really sort of recognizing it for the absolute amazement, you know, absolutely. It's just incredible, really, when we think about it like that. But how often do we give ourselves permission to just like be in awe of this amazing body that we really don't understand?
Correct.
It's very cool. It's very cool.
It is very cool.
So Vegas toning, for want
Yeah,
of a
I
better
was just
term.
gonna say, yeah.
I feel like we're going to say
Vegas,
the similar things to what you already said,
yeah.
but what are we doing for our Vegas?
So there's so many things you can do for Vegas. So let's keep it simple first, right?
Yeah.
So you talked a little bit about Stephen Porges' polyvagal theory, where, you know, we're a social species and we thrive on these things, right? Doing things like humming and singing and smiling and living in your joy and hugs and pets to your pet tap into your vagus nerve.
Yeah.
So like you want to keep it real simple. Smile, give someone a hug, have social engagement, hum your song, sing your song in the car.
Yeah.
That taps into your vagal nerve. There are other more specific techniques. There's a lot of stuff with the ear. So just an easy one, I teach my students this before they ever sit for a test, is take a deep breath in, grab your earlobes, and on your exhale, you're going to pull down and out like an L.
Oh, that feels good.
And then just rest, inhale again, and exhale on the way down and out like an L. And so that is actually a vagal stretch.
Is it
your
really?
Your vagus nerve sits like right behind your jawline.
Yeah.
And so when you pull on you sort of stretch it. And so when you stretch anything, you give input into it. And nerves are really cool, just in general. The cranial nerves are all very like tightly packed in the face. So when you smile, you tap into facial nerve. When you accentuate sounds with your mouth, you accentuate all sorts of cranial nerves. Are you familiar with haka? The native dances.
Not really.
Like New Zealand typically has.
Yes,
they
I
do
know.
haka before their soccer. Do you know what I'm talking about?
I know what you're talking about. Yes.
So haka is essentially lymph and vagal technique on steroids. So there's like power poses and big facial sounds and or big facial movements and sounds.
Yes.
And certain sounds can tap into vagus.
Quite
Simple
guttural,
things like
right?
guttural sounds. There's something, if you want to look up, Perry Nicholson talks about it. It's actually one of my favorite things to do. It's called organ breathing.
I don't think
organ breathing is essentially breathing in and then on exhale making certain sounds, and each sound is associated to an organ. And if I go through the whole series, it's very wild, but when I'm done, I'm smiling. Like I can't not smile. But I do want to just kind of note that when you start tapping into vagal techniques, and depending on which ones you try, you might have different responses, and sometimes they can be emotional. So because we can hold trauma in our organs, if we do certain techniques, you might cry. And so I've seen it. I've seen the smile and I've seen the tears. So just kind of, if you're going to tap into that system, understand that you might have an emotional response that you may or may not be expecting.
Yeah.
So I like to kind of give fair warning on that because it could take you by surprise. But yeah, one of the ones that is related to the heart always makes, I just feel it gutturally. It's a haw sound. And I notice that when I'm stressed, it's the sound I make unconsciously.
Oh, that's fascinating.
And it's related to the heart. So it's just a deep breath in and a
oh my gosh, yes,
so
that is such a natural sound. Yes.
But like guttural.
Yeah.
Like, it just feels like you gotta really give me some, E-Web.
You want me to do it now?
Yeah. Guttural.
Is that it?
Yeah.
That is so interesting. I didn't realize that it could be related to a specific organ. That is fascinating. That is the next thing I'm gonna do after we finish this. Go and have a look at that.
And it's just wild how you might feel. Like you said, you feel a certain way after you do lymph drainage. Same with vagal technique. So something that a lot of people know, but I do talk about it, is I had POTS for quite a bit of time. POTS is a autonomic dysfunction and can occur after infection or high levels of stress. So literally, when I was sitting for my specialty exam, I almost passed out.
Oh gosh.
Mid-test. And then I was fine. Like I kind of sat there and was like, do I leave? Do I stay? Do I wait this out? I was okay. We made it. I didn't actually pass out. But 3 days later, I almost did. And I ended up in the emergency room and all kinds of crazy stuff. And the response is an out of control heart rate, like an inappropriate controlled heart rate. And essentially, It's like adrenal fatigue. It's a it's a dysfunction of your autonomic nervous system. So still my heart rate variability is wild, like not a normal
Mm.
response. But my point of that is when I tap into vagal techniques, I can get very overstimulated very quickly. And so if you have any sort of POTS, which is more commonly understood now because it's a common side effect of COVID,
Mm.
just be careful when you tap in. Don't do too many in a row and just kind of be aware of your symptoms.
Mm.
But same thing, there's a taping technique you can do. And when I put the tape on, it's like I'm on fire. I'm like focused, like over the top, you know, control in that sort of way. But I feel very energized.
Mm. And you
So
taught me that
everyone,
technique too, and I don't feel that. I
yep.
find that if I have a headache and I tape my vagal spots, that will
Mm-hmm.
help me get rid of my headache.
Yep.
But I don't feel energized. I probably feel calmer, I would say.
Yep.
Yeah.
And so that's the funny thing about vagal techniques, right? It depends on what your system is doing in this moment in time.
Yeah.
So when you tap into it, depends on what you're going to feel.
Mm.
In theory, if you were to tap into vagus, you're tapping into parasympathetic. In theory, you might feel sleepy or calm.
Mm. Yeah,
And
some
so
people
some
sleep with that
people,
tape, don't they? I couldn't
they
do
put
that.
the tape on and they have a great night's sleep. If I put that tape on, there is no chance.
Party.
There's, you would think I was like medicated or something because I'm just very hype when
Wow.
I put, it's just amazing. So just a forewarning that if you are going to try these techniques, like
Mm.
pay attention, don't underestimate them.
Mm. I remember
They're
you were
simple.
like, "Don't tape all the spots," and I'm like, "I'm gonna tape all the spots, Rachel. I'm
So
gonna tape them all."
every person, every client I have, I'm like, okay, we're going to try one spot at a time. And I usually, if I can, I sit with them while they have it on
Yes.
because people just, they're like,
You don't know.
it's tape. It'll be fine. And I'm like, do
Mm-mm.
you feel anything yet? Do you feel? I had one person put it on. It was like barely touching her skin and she got hot and just like
Wow.
almost immediate. And then I have other
Yeah.
people who can wear all three spots for, minutes on end. So everyone
I
sort of
can
has
wear
a
it for
different.
hours on all 3 spots. I don't know what that means. Maybe maybe nothing good, I don't
That
know.
means I think it means that you have good vagal tone.
I hope so. I mean, what we'll do is I also think it would be interesting to do those to do the taping and, like, not do anything else almost, and
Yeah.
just sit and notice. I probably haven't really done that, but, I know some of this stuff is hard to kinda just hear and not see
Mhm.
visually, so I'll make sure that in the show notes we share some of the videos that kinda just show this stuff, but like Rachel
Yep.
said, do it with your eyes wide open and, really conscious of the fact that, yeah, you don't know how you will react, but, I'm conscious of the time. I'm conscious of the fact that it is very late where you are, so we're gonna start to wrap up, but, I wonder if you had, like, one thing, and I think you've sort of given us so many one things, but if there's one thing that as a cardiopulmonary specialist physiotherapist who sees, sort of like the worst case scenarios for a lot of this
Mm.
stuff, if there was one thing that you wanted to, like, really impress upon all of us, and it can be more than one thing, you can just give me a list if you like, but, like, what w if this was, like, the last piece of advice we were gonna get about looking after our cardiopulmonary system, what are we doing?
Oh man, that's like a loaded
No
question that
pressure.
you have one thing, no pressure. How about I give you one from each system?
Perfect.
Aerobic, go for a 30-minute walk every day
Mhm.
in some way, shape, or form, even if it's 10 minutes, 10 minutes, 10 minutes.
Mm.
Breathing, always have your exhale twice as long as your inhale when you're consciously thinking of your breath. So
Mhm.
in for 1, out for 2, or in for 2, out for 4. You can extend that as much or as little as you
So
want. And
if
of
we're
course,
doing a breathing practice, that's what we're
yes.
focusing on as opposed to sitting at our desk and trying to do that constantly?
Yeah.
Yeah? Okay.
Basically, I mean, you can think of your breathing all day, every day. So if you're actively thinking of if you're having a breathing moment, you're going to do that. If you're exercising, that's also a good pace to keep. There
Okay.
is a ton of breathing theories out there, so take it if you like it.
Yeah.
Um, And then in the world of, I'll combine vagus and lymph and breathing. The simplest thing you can do is breathe, activate that diaphragm, exercise, and literally find joy, smile, hug, do the simple stuff. Keep it simple.
That's
Is
my
basically
favorite
it.
piece of advice. Keep it
Keep it
simple and
simple.
find your joy. I love that. I love that. And those little moments count, right? Like those little moments of
Those little
joy.
moments count.
Yeah.
Little moments count.
Yeah.
They count for everything. They count for exercise. They count for breathing. They count for vagal techniques. They count for all of it. Same for food, right? If one fruit, one piece of vegetable a day, keep the goals small.
Yeah.
They still make a difference.
Yeah. I love that. Ah, I adore you. Thank you so much for answering my questions.
They were hard questions, E-Web.
I am but a toddler with lots of why questions. I want to know how everything works, but I really
It's
appreciate
fantastic.
I really appreciate you taking, like a career worth of knowledge and sort of just giving us some of the stuff that like we can actually use to understand and appreciate ourselves more. I think that's the big thing that I'm going away with, is just like this real sense of deep appreciation for the systems that exist to keep me well, and to keep me here and to
100%.
keep me able to seek out my joy. So thank you for that. And just thank you for being you. And I've
Thank you.
absolutely loved having this conversation. So thank you so very much. If people want to find you, I'm taken back to LA where I just could introduce you in person. But if they don't have that pleasure, where can people find you on the internet?
I'm on Instagram at all things cardio-pulm _ between all and things and cardio-pulm.
I'll put it in the show
And
notes.
and I'm also on Twitter now, which is a new
Oh,
wild experience, but I'm all cardio-pulm on Twitter.
okay. I have not
Not enough
forayed
room for the
into
things.
Twitter, so
It's
that's
wild.
is it?
If you're there, it's wild. If you're there, I'm there, but I'm just learning and I'm just present at the moment.
Okay. All right. We'll link all the things and website.
Yes, keeping it simple. www.allthingscardiopulm.com.
Perfect. Love it. Thank you so much, Rachel. This has been an absolute joy.
Thank you, eWeb.